Well, it's become quite a close-knit group. I think that the reason people were coming frequently was social. And so this has created a social environment. The sharing of information has been very important as well. They call each other between group visits now and actually share ideas around how to manage the conditions that they have. So the social aspect has been a very important one. I think medically, we've seen their clinical indicators improving as well. So we've really seen improvement in the quality of clinical care. The patient satisfaction surveys have been very positive. We've not been able to retire this group at all. They just want to keep on going, which is a good sign, I think, to suggest that they're getting good benefit from it. The other thing I should mention is they don't come every 2 weeks like they used to. It's been much more appropriate. I do see patients between the group visits, and I've said that I'm open to do that. The majority of them come with additional requests and most of them are psychosocial issues that they bring between group visits, but that's been quite minimal. I think the empowerment that my patients feel. I think that they've really begun to engage in their own care and recognize what the capacity of self-care is for them.
We have seen a lot of benefits actually for our patients. They love to come. They express that they love the camaraderie, the fact that they don't feel like they're the only ones struggling with a particular issue. They support each other. They often get a little bit in each other's face around kind of telling them, yes, you can do that. They are really happy to see each other. So I find that often they come back over and over because they've created relationships with people in the group. So that's one of the benefits, I think, for patients is that not only do they get support from a health professional, but they're also encouraging and supporting each other.
Some of the women that we have in our groups are from other countries, and so they may not have a lot of social support network within the city. Some of them are having a first baby, some are having their third baby or fourth baby. So what's nice is that the women are learning from each other in the groups, and they're really building a strong social connection with one another, which is really incredibly important. I think especially for first-time mothers, but for mothers that don't have a good support system, that's a really, really important aspect of it. And they take responsibility for their health care in a way that I don't see in other models of care. So they are the ones who are charting their progress throughout the pregnancy, how much weight gain is happening, and how their blood pressure is, and what their nutrition has been like. And we catch them early on in the pregnancy. So they start the program anywhere between 14 and 18 weeks of their pregnancy and continue right up until the baby is born, and then we have a reunion group about 8 weeks later. So there's a real strong sense of continuity of care. And they get to know the physicians a lot better as well, which is nice. And the physician is often the one who does the delivery.
I think the biggest benefit is that they have that peer support and that they realize that they're not alone, right? And I think the other benefit is that they're coming in and they're asking specific questions, so they're getting exactly what they want out of it. It's not a structured program, so it's wide open. And I think it gives them realistic strategies that they can use in their own lives. So they're able to leave saying, okay, I've got my answers, I know what I can do, and then they make changes as a result.
Well, we quite enjoy these group visits as well, and we actually look forward to them. Not only have I built the capacity, which is what we'd originally hoped to do, but patients are actually feeling that they are getting better care. And that's spreading through the community, and I have a lot of people that are asking for other kinds of group visits, whether they can join the group visits that we already have. And so that's been a positive and encouraging sign. But primarily, I think we've dramatically improved capacity and our ability to actually give good quality care without that probably over compensated numbers of visits that we were seeing before.
We get to see more people, so our capacity has increased. I find that as a practitioner, I don't have to say the same thing 30 times, so there's more job satisfaction for myself. I also find that I don't have to work as hard because there's a shared role within the group. So participants are taking responsibility for their health, and therefore I don't have to work as hard in my sessions. And I find that we can cover more ground as well.